once again, I am not in our normal filming studio, as you can see, because Lumi the Life Fetus is not here. But we have someone even more exciting than Lumi. And today we're answering some taboo questions, spicy questions, sex questions having to do with penises. Yo, I am so sorry about the inability of my camera to stay focused on the correct place in this video. I thought that the video was too good, and I love Dr. Malik so much, and the information in this was so funny and helpful and interesting that there was no way I could just scrap this video. So just put up with the focus, close your eyes and listen. I don't know, but I had to still post it. It's too good to skip. Why don't we just start by you telling a little about yourself and where they can find you?
Absolutely. Well, thanks so much for having me, Danielle. It is an honor. I am a urologist and pelvic surgeon. You can find me on YouTube. My name is Rena Malik, MD. I make content on urologic health, sexual health, and so much more. So if you like to learn, like as you obviously do because you follow MDJ, you will love my channel as well.
I need to have you dispel a very common misconception about urology. Are you a penis doctor?
No, I am not a penis doctor. So urologists are medical and surgical doctors of the genitourinary tract, which includes the kidneys, ureters, bladders, and genitals for both genders, or all genders really. And so we take care of many. In fact, I did a fellowship in female pelvic medicine and reconstructive surgery, and that includes management of women with urinary incontinence, prolapse, recurrent UTIs, pelvic pain, interstitial cystitis, which is a lot of women. And we also obviously take care of women with kidney cancer, kidney stones, bladder issues. So all of that.
Very broad. Because often people will say, oh, a gynecologist and a urologist are equivalent, but it's not at all the same.
It's not.
And it's not at all the same and opposite.
Yes.
So I have asked Instagram for questions, and I'm really excited because I can't answer most of them. So I need your help. The most common question in this is about breaking penises. How does it happen? I saw it on Grey's Anatomy. Is it real? But there's not a bone. So tell us what it is, and also what do you do about it?
Yes. So it is called a penis fracture, and it happens when you have an erect penis and it gets bent towards the pubic bone, which is the bone that sits right above, right down in your pelvis that you can feel above your urethra. And so when it gets bent in that direction and it's erect, there are these tissues called the corpora cavernosa. So they're like these round cylindrical tissues that are what get hard when a man has an erection or a penis owner has an erection. And when you bend it very vigorously or aggressively in that direction, it will cause a fracture of those corpora. And it will cause maybe a popping sound, a lot of pain, and a lot of swelling. So you will immediately stop. They will detumesce and you will go to the emergency room because this is a surgical emergency. And I realize it's embarrassing. We've had people come in doing all sorts of things at the time when this happened, which could be they perceive as embarrassing. We do not perceive them as embarrassing. We want to take care of you. And it is really important because we need to close up those areas that have fractured. If you don't, the risk of erectile dysfunction is upwards of 50%. So you need to get to the hospital as soon as possible to get this surgically corrected.
And how do you fix it?
So we basically deglove or open the skin near that area. Degloving means like you make an incision around the penis and take down the skin so that the erectile tissue is right in front of you, and then you suture that closed, essentially. It's not a very challenging surgery. Sometimes there's a urethral injury, meaning the P-tube also gets disrupted. That's a little bit more technical because you have to sew those ends back together. But ultimately, we close that area up, we close the skin up, and then you have a special bandage for about 24 hours, and then, it gets better pretty quickly. The good news is the penis is a highly vascularized organ, so it recovers very quickly.
Awesome. I mean, awful, but I'm sure not awesome if it happens to you. Do you ever see it happening without being like sex? Like, can it happen traumatically, like car accidents, or what have you?
I mean, car accidents, not so much. You're not driving around with an erect penis for the most part, unless you're doing, you're in the act, right? And that's, I guess that it does put you at risk for a car accident.
Have you ever seen it and related to anything other than sex?
I mean, I guess really vigorous masturbation, but I've never seen it.
Okay.
I've heard about it. There's actually a Middle Eastern technique. I think it's something, I'll have to look up the name, but Tanagin or something, where they actually very forcefully bend the penis when it's erect. And I think it's cultural because they think having an erection when you're not supposed to is a bad thing. And so those people do get penile fractures. But that's the only like other consistent thing that we see.
Okay. Someone wants to know, and you don't have to answer this, why do people want to put penises in their mouth?
Well, I would say because their partners find them very pleasurable. And also there are some women or men or whatever gender human chooses to put a penis in their mouth. They actually like the oral sensation of the penis in their mouth.
And some people just really appreciate pleasuring their partner.
Exactly.
And that's an important part of sex for a lot of people.
Yeah.
Oh, this is an interesting one. Are left curves really more common than right curves?
So actually the most common curve is dorsal. So meaning it goes upwards a little bit. That's actually the most common.
Okay, interesting. Why? Is it just an embryologic thing, or is there any reason that people get that?
There's no reason, but when you look at studies where they describe the like degree of curvature in normal healthy men, there is curve. Like there are several people who have like a 0 to 15 degree curvature, and it's not a problem. It's not dangerous. Sometimes people develop Peyronie's disease where they get a like a plaque formation, and then that creates a more distinct curve, and that can cause distortion of the penis, or it can make it difficult to have intercourse when it becomes more of an issue. But otherwise, if you have a curve, you're having good sex, you're not having a problem, nothing to worry about.
This one is more just funny. One time in college, I heard when you wake a man up with oral, he might pee in your mouth. I have been haunted by this and haven't tried it with my husband despite his wishes because I'm scared.
No, I don't think he's going to involuntarily void in your mouth. That is not going to happen.
Oh, I love that question. Okay, let's see.
You got a great audience.
They have like no bars hold all the time. They will ask anything.
You'll love it.
Lots and lots of questions about anal sex. Is it going to permanently damage me? Why do people enjoy it? Maybe we should just talk a little bit about it.
Yeah. So anal sex is, some people do find it enjoyable, right? And I think this is sort of a correlation between like, do some people get stimulated with G-spot stimulation? Do some people enjoy deep vaginal penetration? And that's like kind of on a spectrum. So people find pleasure. There are innervations inside the anus that are, areas that can be pleasurable. It's also not too far from the clitoral body. So that can also be stimulated and enjoyed through anal. Now, is it going to permanently damage you? There are ways to prevent damage. You can hurt yourself with anal sex. So you want to use lots of lubrication. The anus is not, and the rectum are not lubricated naturally. And you want to ideally use lubricants that are the same pH as your anus, which is different from the vagina. So buy lubricants that are for anal sex and then go slow. Like you don't need to immediately penetrate, and like it's not going to be like having vaginal penetration. It doesn't expand. It doesn't like get bigger and longer and wider. It takes a little bit of preparation and practice. And so you start with smaller objects like a finger, and obviously only objects that are meant for anal play. Yes. Because if you use something like a you can lose it, and you don't want to
easily. Actually, I don't think people realize how easily things can go missing, and you don't want to have to deal with that.
So you want things with a flared base. So when you buy anal toys, they're always with a flared base, or they have like a handle, so you won't lose them. And so use those, and then you slowly get to the point of accommodating a full girth penis.
And we talked a little bit about this when we filmed your podcast, but really great resource for this specifically would be OMG Yes, because they go through, how to, if you're interested in that, how to approach it, like answer all of these questions that you might be too afraid to ask your doctor or your friends, and it can be really helpful. So we'll put that in the description below as well.
And there's no shame. No shame.
Absolutely.
Yeah.
Is semen considered vegan?
This is an interesting question. I guess, yes, it would be considered vegan. There are no animal products in semen. It is made by a human, so I guess it just depends, right?
If you don't eat honey, maybe that's in the... I feel like most people just see past it and it doesn't matter.
Yeah, I will say I've shockingly not been asked that. But there's also like this weird movement of like semen smoothies and semen facials and oh yeah.
What? Yeah. You need to make a whole video about that.
I have resisted, but I think I need to.
Although I will tell you, I recently made a video reacting to placenta TikToks, and I've never made a video so hated by my audience. Like, everybody left after the first one because it was gut-wrenching. I mean, I don't really blame them, but they hated it, and I won't be doing it again. Lots of questions about piercings, which is different than the second part of this, but also circumcision versus not. So let's talk about circumcision, because a lot of people have questions about that. Is it good? Is it bad? Tell us your thoughts.
Well, I will talk about adult circumcision because I think it's very heated on the child side and the children can't consent for it. And there's a lot of people who feel a certain way. But in general, in terms of circumcision, the benefits are, one, that it does reduce your risk of penile cancer. It almost virtually eliminates it. It reduces your risk of sexually transmitted infections and STDs. And so for those reasons, it's considered a good option for certain people. Now, it is not mandatory. In terms of pleasure, which I think a lot of people worry about, when they've looked at studies on adult men who've had either gone through circumcision, so they're like they're their own control because they had sex before, they had control after, they had sex after, they've shown no evidence of loss of sensation or change in sexual function. Now, people will have change in sensation for a short period of time. Like, they will be hypersensitive for about a month to 3 months, depending on, their individual body, because they now have a gland that's like out to the world, right? So basically there's no other really like negative about it in that respect.
Yeah, that's an interesting topic. And I was going to ask you about one thing you said, it almost eliminates the risk of penile cancer. So even HPV related penile cancer, you don't see in people who are circumcised?
Yeah, we don't.
Really?
Well, penile cancer is extremely rare,
right?
But it almost virtually eliminates it because it always happens in the foreskin.
Okay.
Yeah.
Interesting. I didn't know that either.
And I think just a caveat with the sensation thing, while the studies show that it doesn't, there are definitely men who feel that their sensation has changed permanently. And so I don't want to gaslight them.
Absolutely.
I want to say, your experience is real, and I'm just telling you what the studies show.
Yeah, I always try to make that a point on my channel too, is like, you're not a research study. So if I say something and you fall into a category that you are like, no, that's not my experience, that's okay. People have experiences that are not what the like majority findings in research are, because that's when you're looking at everybody thrown together, right? But if you're an individual and having an individual experience, in some ways, it almost doesn't even matter what the research study says, because you have your thing that you're dealing with. So
right,
it's still really valid. This is a good one. Does cupping the balls feel good? This isn't a penis question, but I still want you to answer it.
Yeah. So, some men do find that pleasurable, but the testicles are very sensitive. So you just want to be very gentle with them. So the penis doesn't end just where you see it, right? The penis goes all the way back and down into the perineum. So that's that space underneath the testicles, between the testicles and the anus. And so sometimes stimulating that area can be very pleasurable.
I think that's a theme of every question of like, why is this pleasurable? Is this pleasurable? Is this good or bad? Is like, it's individual. Everything is so individual.
Yeah, always. I think there's so much value in like exploring your erogenous zones with your partner. Like, it doesn't always have to be about penetration. Like, be like, hey, today we're just going to be intimate. And we're just going to like feel each other up and see what feels good, right? And then you learn about each other. And I think that's so important. And we just don't take the time to do that.
Yeah, I agree 100%. If I give someone a blowjob and then have penis and vagina sex, is this risky? Will it cause a UTI or BV? I'm scared of having saliva bacteria up there.
No. The vagina, as you've probably mentioned many times, is an amazing organ, and it does not, people put a lot of things in their vagina and they don't get infections from that. So there's a big myth that like you're getting a UTI from your partner, and that's not true. It's the actual physical action of like the penis moving in and out that puts you at a little bit of risk, or if you're using a spermicide, but it's not from the partner or saliva or anything like that.
And I think we see that too. People are afraid to have oral sex because of that. And yeah, it's the same. But the one thing I will say is you should never go from anal to vaginal or oral, obviously. So that's an important point to stop, wash, because that certainly can cause issues.
And new condom.
Absolutely. Can my dentist tell if I've given oral sex to a man?
No. The answer is no.
Same as, can my gynecologist tell if I have had a penis or a toy in my vagina? No.
No, we can't tell.
Yep. Okay. Where do you want the people to go to find you?
You can find me on YouTube at Rena Malik MD, and I'm on all the socials as Rena Malik MD. If you choose to follow me elsewhere, I would love to see you.
And she has a very high proportion of her audience who identifies as men. So we need to get some of y'all over there to be learning about penis sexual health, because a lot of you identify as women.
Yes. And I talk about urinary health for women and sexual health for women as well.
And you've done a whole fellowship in pelvic floor health.
Yes.
Okay. Thank
All
you.
right.
See you next Monday.